Welcome to our Digital Technology Against the Virus session here. I hope that you can listen to me and you can hear me. I'm very excited to be here. I think this is the second best thing we can do besides meeting personally. It's a shame that we had to postpone our meeting, but there's still chance and hope that on September 21, we are going to be able to meet each other. My name is Alfred Angerer. I'm going to be the moderator today. I'm a professor for business management here at the Zurich University of Applied Sciences. In a city called Winterthur next to Zurich. I'm working in the Institute of Health Economics, and my research focus is on efficiency in healthcare, lean management, but obviously also on digital health. And this is what we are going to stress today. We are going to talk about all the possibilities digital health is offering us today. Maybe one of the buzzwords you have heard out there is the word resilience. So the core is very true, you know. It means that you should prepare, adopt, and respond to all these changes, all these events that happen from time to time. Now we have a very major event with the coronavirus. And I'm here to discuss how can we make our healthcare system more resilient? How can we prepare? What can we do? How are the different countries responding to this? And I'm very, very happy to have here 7 different experts from countries around our planet. And before I get to introduce our experts, I would like to share with you some comments on our session today. So we aim for having 1.5 to 2 hours. You're welcome to stay until the end. At the moment, you see there's a mini poll out there. Where would you want to see your opinion? You have to press on the little button to the right, and there you should be able to listen to or to be able to participate in our little survey. We want to know, is this going to be a game changer? Are we going to boost our digital health technologies with this pandemic? Another chance you have here to participate is via chat. So you can post your questions there, and Ralf Haller and his team, he is going to review those questions, and from time to time, I'm going to ask him if there's anything you would like to ask to any one of our participants. Otherwise, the thing is recorded, so let's get started. And I would like to start with my very first guest, with Dr. Evangelos Avramakis. Hello, Evangelos.
Welcome, everybody.
I would like to say some short words about you. You work for the Swiss reinsurance company Swiss Re. You are the head of digital ecosystems R&D, and you have a master's degree in sports science, and you hold a doctoral degree in business innovation. So far, so good?
So far, fine. Thank you.
Excellent. And obviously, you are the insurance guy. So I think in your business, you're very used to risk. You're very used to have a look on the future. And what I was wondering is, are there any good working early warning systems for healthcare? Do you have any insights for us how we as organizations can prepare better for such events?
I think what we have here now is a very special situation where it's not only affected on one single area, it's really affecting everybody. I think we have some solutions in the market already when it's about chronic diseases, depression, diabetes care. So there are some great tools and technologies available. What we are facing now is that everybody needs to get measured, everybody needs to get kind of diagnosed, and how this data is being collected and shared among different entities and parties involved. This is something we have not clearly defined from a regulatory perspective, but also from a policy-making perspective. So if you compare what is going on in China and compare to the Western world, I think there's something we are not playing in the same space, I would say. So there are some privacy issues that are deeply impacted, and we have not figured out how to cope with that. So all this discussion around the tracing technologies, I think we're still trying to cope with the best technologies, whatever. And in China, to some extent, they're just dealing, or South Korea, dealing with the same way in a different perspective. So there are great solutions to my mind from a technology perspective, but also from a regulatory or policy making perspective, we we have not found the right time to discuss exactly this in a very short period of time. This is where we more or less struggling.
Yeah, the topic about data privacy is always a big topic. But let's focus for the first on the technological part. So what kind of technologies do you have there in mind?
I think there's already some great wearable technologies that are measuring on medical grade. The question is, do we always need this kind of accuracy to make everything, or do we need a kind of early detection, early warning signal where we get early signals where we need to measure those people, whether they might be already affected, yes or no. So I'm not talking about only temperature measurement. I'm talking about perhaps oxygen saturation, blood pressure, perhaps. There are some other parameters that might give us an early indication already whether we might be at risk and whether we should take some actions. On the other hand, there's I think one or two technology available, especially in Israel, where you just use the mobile phone to get medical grade of kind of vital parameters. So everybody's got a mobile phone. We just need to apply this technology, and then we might be able to early warn everybody, and with kind of manual kind of symptom detection tools. In addition to that, there might be a very early prediction kind of models that could be available. The question is, where do I ship the data? So it's not only how to get the technology right, but also how to share the data and the insights and who's going to govern that. So it's about data governance, and it's about the wearable technology in the very end. So this is where I see, besides the medical side, where we have huge opportunities.
All right, but you're talking about very fascinating technology, and you're here in Switzerland. And if you have followed the press, I'm sure you have listened to all these complaints about our maturity level here in Switzerland. So we are still sending fax to our from doctor to patients and all around the healthcare system. And you're talking about this very advanced system. So I see a really huge gap there. How can we close that gap?
I mean, it's something like, if you don't even have a kind of direct relationship or a digital relationship with the customer. So think about insurance companies. How many times have you been contacted in the last 8 weeks from any insurance company? And how was this interaction being happened? I'm not sure that in Switzerland we have a lot of email addresses where we can directly connect to that. And on the healthcare space, we're still struggling on electronic health records. So we're really lagging behind, right? We try to do the best thing possible. But when we compare this into what is happening in Southeast Asia and Asia, I mean, that's kind of different game already happening, and we're lagging behind. We should be, we put other things in more priority, and so far we didn't have any urgency. So there was not a opportunity to really act fast, and this is why, perhaps to some extent, besides the regulatory and the policy making perspective, there was no urgency in doing this in a very immediate, immediate manner. And I think the responsiveness shows us here clearly that if you're not ready to deal digital, to interact digital, and to act digital, then you might really lag behind. That's the problem.
I see. Well, we are now in a situation where maybe we have to react fast. The discussions are shortened at the moment. I guess you're very disappointed here in Switzerland that we delayed our tracing app. It was supposed to come out today, but now the parliament wants to discuss and make a law. Would you make it different if you were in power?
So that's a tricky question because it's more on personal level. I think we were quite lucky in Switzerland, so we were not affected as other countries around us, like Italy, like perhaps France or Spain or the UK. So on this perspective, I think we're to some extent fine. Is this now the reaction we should act in the next wave? So if there's a second wave coming and it's going to be huge wave, perhaps there might be a huge wave, will we have all the measures being ready and implemented in this kind of short period of time? We need to discuss how we're going to do that. I'm not sure. I'm just not sure because all the discussion that should be happening in between have not happened. And this is where I think other countries who might act in a very decisive manner might be better off, just because you need to act very, very fast at the beginning in a very decisive manner in order to protect the economy. And I think many examples here, especially in Europe, show that, this kind of, we kept on waiting until it really got bad, and then we acted. And then it was to some extent also a little bit late. And I don't know whether we can afford this kind of behavior the next time the same way.
And one last question for the moment for you. You have had a lot to do with digital ecosystems, business model innovation. So where do you see a chance of this pandemic to create maybe new business models out there?
So I would just remember, about 10 years ago, we had the tsunami in Japan, and just based on this kind of incidents, a lot of early warning measures will be implemented around especially Southeast Asia. I would expect that many areas in the world and many countries will act something similar to get prepared for doing something. So it will be a lot about data-driven business models, because the data and the accuracy, not always the accuracy, but the data insights will help us a lot in order to model better, in order to exchange better, and to exchange values among different parties involved. Not only about sharing the data insights with the governments, but also all the healthcare environments, the technology solution providers, the medical staff. I think there's a huge opportunity to get the insights and to share the insights in the right way. And I think if we learn how to do that in the way we really can protect our people in terms of privacy perspective, we can provide a lot of value to the communities and to populations. So far, we didn't have this kind of discussion, right? We have in Switzerland a kind of, productivity issue from a healthcare perspective, because we're not as productive as Meetby should be, especially when we use technology and digital transformation measures. So we're still lagging behind. I think there's a lot to do there in the area, and one of the key discussion will be how to access data and how to model different kind of diseases, whatever, in order to prevent ourselves from future pandemics or cardiovascular disease, whatever is going to be there.
Do you have any concrete example in your mind when you say, oh, this is really a good business starting at the moment?
So there was a nice study being conducted, I think, in Singapore about 4 years ago, where they could predict based on blood sugar measurement diabetes about 10 to 15 years in advance. So think about when we can take other data sources and try to come up with a similar kind of accuracy, perhaps 5 years, perhaps 10 years. What if you can implement those kind of models where we don't need a kind of medically grade accuracy, but where we can implement these models in order to act as a behavior change model to the communities? And this behavior change is something we urgently need. I think we are far away, so nobody has a kind of behavior intervention measure being implemented. And I think this is something we should carefully consider to do.
All right, thank you for the moment, Evangelos. Let me move on to Dr. Ramburgi. He is the founder and consultant of the Swiss company HealthBytes, which focus on healthcare and life sciences. He has a Master of Business Administration as well as PhD in molecular biology. Thank you for being here, Ram.
My pleasure. Thank you for the opportunity to be here.
So I understood you're a consultant, and when you're dealing with your customers, do you have the feeling that the questions they have to you have changed recently?
I mean, that's an interesting question, because the kind of question depends on to whom you're talking to. So if you're talking to people from different countries, the questions are different. And if you're talking to advanced healthcare systems like in Switzerland, then the questions are different. What I'm trying to say here is that depending on your environment, you ask different questions. And this is, I don't know if we are as a Swiss at a disadvantage here, that we are not able to think through the most simple solutions, and we always go for the advanced solutions, and thus the questions are more advanced in nature here. But the basic question, people around the world have basic problems, basic healthcare problems, which needs to be addressed with very simple solutions. And the question is not to make a bigger stent or a more advanced stent, but to make a stent which can be affordable by majority of the people. So the kind of questions which I'm being asked here is more advanced in nature. And of course, given my experience in this advanced healthcare, I'm able to better, work with them on that questions. But when it comes to questions from other countries like I don't know, India, China, Africa, the questions are different. It's about frugal innovation. It's about different kind of questions. So as a consultant, of course, I've been trained to address and put myself in the consumers or customers' position to answer those questions. But I see very different questions being asked by different people, depending on the environment.
And the question about resilience, is it something that now people are starting thinking about? How do we make our system more resilient? Was it already on their plates before? Is it even sexy to talk about that topic? Health prevention, resilience of my organization. Who cares really about that before the pandemic, right?
It's resilience is something very inherent to business. It's not about, as a business, you have to be resilient. Otherwise, you'll be, today's world is so fast paced. You have AI and so machine learning followed by AI, literally taking the rug out of our feet. So we are moving at really fast pace. So we have to be able to adapt and be resilient to changes so that we don't get pulled over by the tide of the new technology innovation and disruption. So I think the famous example I normally give, everyone knows, is about the use of photocopying. Xerox invented photocopying, but Canon actually benefited from that. The reason is Canon was very resilient and it was elastic, and it was able to apply innovative business models to charge per copy, and that's why they were more successful than Xerox. Almost no one knows about Xerox these days. It's Canon all over. So you can see that this resilience has to be inbuilt into any industry, into any company, not just in the COVID era, but any time. I think it's always helpful to have that.
Do you have at the moment any technology out there that you see where you say, oh, this is really going to be something special, some digital health solution that's going to help many, many people?
I'd like to say I'm a big fan of using technology to resolve the healthcare issues, and also the use of frugal innovation. So one of the projects which I came across was a project which was using use of crowdsourced data to detect COVID-19 through analyzing voice, breathing, and coughing patterns. And this incidentally comes from an institute where I used to work before, the Indian Institute of Science in Bangalore, in a country known for frugal innovation. So what they try to do is they are crowdsourcing people's voice, their cough pattern, their breathing pattern, and trying to use voice analysis and pattern recognition to figure out if they have a COVID-19. And I talked to another physician in the area of pulmonology, and he was saying that the next bigger wave is exactly something like COVID-19, a respiratory disease. And there'll be a lot of issues with respiratory disease in the coming, I don't really have the data behind it, but that came in the duration of the discussion. So this project called Kosvara, it's starting to collect data to analyze the voice to come up with the analytics for COVID-19, and this could be used for different purposes, TB, for COPD or whatever. So there are different ways you can use this data. So this I found very interesting to use technology to solve real world problems.
And you said it was crowdsourced, so you use the power of the people out there to help you with this research.
Exactly.
But how can you? Is it something you can repeat as a company? Or are there very few cases where you could use such an implementation of innovation?
In the sense I meant crowdsourcing is that to collect data from a crowd and then have a crowd to analyze the data. But it's a challenge. We'll see how that works out. But I found it interesting to go in that direction, to be able to use data from different parts of the world, different breathing, very sensitive issue. To use such a data to come up with solutions, I found it very interesting. And of course, we have mobile phone penetration is much higher in the Asian region and African and other countries than actually in the Western world. So this way we are able to use the power of mobile phones to be able to do a very rapid detection of such pandemics. I mean, this is not the first one we are going to see. There's going to be more. So we better be prepared with this. So.
Okay. And one last question for you for the moment, Ram, as you as a health innovation expert. So let's assume I'm in a hospital and I really want to implement this into my organizational structure. I want to be innovation, not only the medical part, but also the innovation in general to be inherent part of my business. How would you go there? What kind of structure do you need to make such innovation possible?
I mean, that's not an easy question to answer because a lot of people are grappling with that issue. The main thing is about the recognition that digital health is a tool. It's not the end to itself. It's, I think, the first step. So I would be wrong if I say that digital health guy has to go and put his Flagstaff in the middle of the thing and say that I'm the king. No, you should not do that. But the question is, this is a tool. It is a travel to the end. It's only a tool. So you cannot use that to solve all the problems. However, you can use that to help to deliver the healthcare to the people through the touch of human in the whole process. We can only use digital health to a certain extent. So this has to be kept in mind when you're implementing any policy in any organization. I think that is key to understanding that health is about human touch. It's digital, it's not a magic bullet. You cannot change that. So if people start to understand that, and that's a value which you're driving through the system, I think that's what is going to change the way. So I don't have an answer for the right organizational structure because I've read many articles on how innovation comes up. There's a good example in the post-World War II era where MIT and Bell Labs came together with a lot of innovation by getting multiple skills together. And so to get all the skills together is where the digital innovation will take place. You need to have the skills, expertise, and infrastructure. If you don't have it, get it from outside. Simple answer. So.
All right. Thank you very much, Ram. I would like to move on to Israel, and I would like to talk to Dr. Eyal Zimlichman. I tried to pronounce it. Eyal, thank you for joining us today.
Of course. Thank you. My pleasure.
So you work for the Sheba Medical Center in Israel. It's the largest hospital in Israel, is what I read. You are there the Chief Innovation Officer, and you are as well the Chief Medical Officer. You're a medical doctor, and you have in addition a degree in healthcare management. So yeah, my first question to you is, let's keep on the topic of innovation. This is not going to be the last time we need technology to help us, that we need innovation. So do we always need such external pressure like a pandemic to be motivated? Do we really need these big events to something to happen within our hospitals?
Well, I think it depends on the hospital, but generally, as we look at how things are going, obviously, the times of crisis create opportunities. We know this from the past as well. This is not the first time this has happened. I just want to remind all of us that penicillin was invented during World War II, and how many people were saved because of that discovery back then. So we know we move faster in times of emergency. We know we move. We devote more funding in times of emergency. We cut corners many times in times of emergency, and that allows us to move much, much quicker. At Sheba Medical Center, we have a very strong innovation program on day-to-day outside of such catastrophes. And for sure, I can tell you, while we're moving quicker than most other places in times of in normal times, when we went into COVID-19, our innovation program really went through a huge acceleration of development. We were very well positioned to take this to the next level because we had the infrastructure already set up. Our innovation team is about 40 people that do 100% of their time innovation. So when we were challenged with COVID-19, we made a decision. We're going to focus entirely on solutions for COVID-19. We placed everything else on the side, and we paused much of our activities to turn our attention to COVID-19. And indeed, within about 2 or 3 weeks, we were involved with more than 40 different innovation projects for solutions in COVID-19 from all types and levels of innovation. So I certainly think that these times pose opportunities, and we need to learn from them as we exit this event, and it's going to happen, obviously, at some point. What are we learning from this so that we don't need such catastrophes to move as quickly as times of emergency? Maybe we could quicken the pace also post-COVID-19 and not just as we go through it.
All right, so you were already very well prepared with 40 people. We will have to talk about this because most of the hospitals I know here in Switzerland, they have maybe one guy if you're lucky. So you were in a very special situation. What did you do with that? So what was the outcome? You said you put all your people onto COVID-19. Can you share some results of your work there?
Sure. As I said, we really worked in all the different areas. And of course, when you talk about COVID-19, people tend to think, of course, about an immunization, of course, and therapies and so on. We were working in that as well, a couple of solutions on cell therapy and IVIG treatments and so on. But the main focus was in diagnostics, digital solutions, big data analytics, and telemedicine. And probably telemedicine was the biggest effort we've done. On normal days, our program, which is called ARC, by the way, stands for Accelerate, Redesign, and Collaborate, Accelerate Innovation to Redesign Healthcare by Collaborating with Partners. On normal times, we focus mainly on digital health. That's the main focus. And so we push that towards COVID-19 with a lot of solutions, as I said, in telemedicine. And I could go into many more examples specifically within telemedicine, but also mobile technologies, our ability to use artificial intelligence on video surveillance cameras in the hospital that are already in place to detect contacts, so that if we have to do for example, if we have to do an inquiry, if one staff member turns out positive with the virus, you want to know who he was in contact with so you could send them to isolation. We use the surveillance cameras with AI to find out who were the other staff members who were in close contact with our index patient. And we could actually set it to 1 feet, 2 feet, 3 feet, 5 feet, 6 feet, or 10 feet away. What do we call contact? And also we could set it for the length of time that they spent together with our index patient. And also we can ask the AI only to let us know of those people that didn't have a mask on. So the AI would tell us who were the people that were within, for example, 4 feet away for more than 3 minutes without a mask on, and within a few seconds you get the results. So this is another example. And in diagnostics, as I was mentioning, many examples from spectral imaging to voice analysis, which was mentioned before, to scent analysis. So a lot of activities really across the spectrum.
All right, let's focus on maybe the one you were just mentioning with the face recognition. And I guess, well, I don't have a number, but the majority of Swiss people would on the one hand say, wow, that's fascinating. You have the technology to detect who was next to whom, who was eating with whom, who was infected, so we better get him or her tested. On the other hand, they will say also, oh, but is this like breaking my privacy? So can you share with us the process? How did you get your staff members to be accord with that, to accept that technology?
Sure. Of course, it's an issue that was brought up. The sort of big brother watching, which we're all sensitive to as well. So a couple of restrictions we had here. First of all, as you know, the surveillance cameras are in place in every hospital, I think, in the modern world today, for surveillance issues, whether it's theft or anything else. And typically, the videos are kept for about 24 hours and then erased. Because if there was an event, security event or some other event at a public location in the hospital, you could quickly go and check the cameras, or they could be evidence in court and so on. But if nothing happened, then after 24 hours, it's on a loop recorder, so it erases itself. So this was the exact same thing here. The cameras were in place. We didn't have to add one camera to this application. We used the existing surveillance cameras only in public places. So this was not in patient's room. This was not in staff room. It was in the hallways. It was in the public areas where people were gathering, waiting areas, things like that. And once the staff understood that that this is pretty much the same routines that happened before, we're just using it not just for security issues now, but also to detect contacts. And after 24 hours, if nothing happened, then everything is deleted. Then, of course, they were more at ease with that.
All right. And now that you have so many advanced technologies out there, maybe you can share with us, do you see any gaps at the moment? Do you see any opportunity for a technology to say, oh, we should develop that in the near future because that's going really to help us here at Sheba Hospital?
Sure. I'll say a couple of things here. One is, I don't think it's a gap, but I think for sure, we're going to be seeing in the immediate future much better AI solutions on video data. Of course, we're working now on a lot of AI on clinical data. We're working on AI. Now we're starting to do this with voice data, but video data, it's still premature. We're seeing a couple of applications around the world now, but it's still a premature area. There are so many use cases for video AI that I could think about. We're in development, but very early on. I'll give you another example. Apart from the face recognition, by the way, the face recognition is another application we're using for that, which I think would be interesting for the people to hear, is the fact that if somebody is coming into, for example, a department and doesn't have a mask on, although there's a big sign that everybody going into the department has to have a mask. If there is no mask, there's a very light beep that sounds to remind you to put the mask on. And so you might just forget to put it on, and now you hear the beep, you put it back on. So this is another use for that, the same technology. But another use for video technology is, for example, on staff that need to go into these isolation spaces. As you know, they have to wear the protection gear. They look like astronauts, of course, with all this gear on. What we typically do to make sure they've put it in the right way is we have an infectious disease nurse that is observing as the staff member is putting on the gear, and then gives them the thumbs up that they can go in, that everything looks okay. Why not replace that with an AI, with a video camera, that you do this in front of a video camera and you get either a green light or a red light if you've done everything okay. So we have started to develop something like this. It's a challenge. It's not so easy, but this is where I think we're going to see a lot of improvements in the next few years. Another area where there's obvious need, and I think everybody would agree, is diagnostics. There's a gap right now. The PCRs are not so accurate, as you know. There's about 20-30% false negatives, and it takes the time, and it's more it's more costly. We're looking for other ways to do diagnostics, so that's a clear place for innovation to come in. And maybe the last thing to mention is something we've seen a lot happen right now with COVID-19, and that is the use of devices to allow clinicians to inspect or to perform physical examination on patients from afar. We have these solutions. We've been using them in day-to-day. A company like TytoCare and other companies that have these devices that allow somebody at home to be examined by a doctor who is, maybe a couple of kilometers away, but performing a physical examination, listening to the heart and lungs, looking into the throat or into the ear, or looking at skin lesions with these devices that can either connect to your smartphone or even be independent. This has only been done outside of hospitals so far. With COVID-19, we had patients here in isolation. We wanted to minimize contact between staff and patients, and we used the same technology inside the hospital, maybe for the first time, to allow doctors to examine patients without being next to the patient and being in risk for the virus, of course. At first, it wasn't so easy. Most clinicians felt that nothing would replace the traditional stethoscope and being at the bedside. But once they started using it, they saw that the level and quality of the examination was just the same as the traditional stethoscope and standing next to the patient. And we're seeing an uptake of this technology, which was quite amazing. We're doing a survey now between our doctors to get some feedback, and we're going to publish this as a paper. I think for the first time, getting input not just on video conferencing calls and things like that, but actually using devices to examine a patient from afar. So I imagine we'll see much more of that coming in the next few years.
All right, I see that you have many ideas. You're 40 people who have a lot of work to do. Thank you very much, Eyal.
Thank you, of course.
Let me remind everyone here listening to this session that we have the opportunity to ask questions. And Ralph, I don't know if they have been using the opportunity, if there's anything at the moment we should ask our participants so far.
Yes, we got a couple of questions. One was, I think, related to what Evangelos was saying, but others who know Switzerland well can probably answer this as well. Someone asked if Switzerland would have been forced to move faster, would they have ended up not so lucky and run into big problems? That was one question related to Switzerland, maybe not being too fast as was mentioned.
As mentioned before, I mean, we were just lucky that we weren't hit the same way like our neighbors were. So Northern Italy or France or yes, perhaps Spain and the UK. But what I want to say is that how can we prevent for the next time in a much better way? How we can leverage technologies? I mean, we just heard one or two examples from the hospital. What if we can early detections and try to intervene in a very meaningful way and to prevent people from being at risk no matter where they are? I think we should carefully think about how we're going to prepare ourselves for the next wave, no matter when it's coming and how much it will impact us. I think we should really think about this kind of things because there's a lot of opportunities, especially in disruptive technologies, and we should be carefully thinking about how we're going to leverage the technology and data in order to be as a society much more resilient. I think this is really a huge need. And I think technology will play a fundamental game. So just one thought, if we have all Apple Watches, they are just too expensive, right? So we cannot spread all the Apple Watches with any kind of medical grade kind of parameter detection to everybody. So we need to come up with alternative solutions where we can leverage the same technology to everybody in order to prepare ourselves, in order to make our places much more safer places than we have right now. And I think this is something we carefully should think about it. And we didn't have any urgency. That's the other problem. So it's still an urgency issue here.
All right, thank you very much, Evangelos. We are coming later to more questions, so please continue asking questions to our experts here. I would like now to move from Israel to Denmark and welcome, please, Dr. Lars Malou. Hello, Lars.
I need to practice my voice here. Yeah. Can you hear me?
You are the Chief Technology Officer at Corti and a co-founder of Corti. Corti is a Danish company known for its artificial intelligence products, helping humans taking better decisions. You have a Master's of Science degree and a PhD in machine learning. So, Lars, this morning we didn't hear anything about Denmark. Can you share maybe at the beginning, how is Denmark dealing with the whole pandemic? How are you doing?
I think that first of all, I would like to stress the fact that I am a machine learning PhD and I have no doctorate or medical doctorate degree. So I wouldn't say too much on the medical aspect of Denmark, but I can talk as a citizen here and I can talk as a technology provider for the Danish government. And I can say that Denmark as a country is on the forefront in terms of their healthcare system, in terms of supporting the citizens, and they have been very restricted from the get-go, which seems to pan out successfully, at least for the first wave here, where they are opening up society slowly now.
All right. Yeah, was already talking a lot about artificial intelligence. I don't know if you were writing because you had many good ideas. But I think when people tend to hear for the first time AI, artificial intelligence, and I know that you mostly don't like that term, that's just for marketing, but that's fine for the moment. Many people overestimate it, and the same amount of people underestimate AI. So what would you say? What do you hear more? AI is going to save us from this pandemic, or AI is completely overrated?
I think that people are slowly converging into the fact that AI is definitely something that can change the healthcare sector, and also change the healthcare sector for the better when it comes to a crisis like the Corona crisis here. I think that there are also a lot of good ideas and quick ideas in order to save humanity, so to speak, that are maybe unsolidified in research. So what I would rather answer to your question is the fact that if you ask me towards where I see some health innovation and where the public actually sees some health innovation, I would say in a very few examples that we actually see AI being productively used in society. We are still using the statistical frameworks for disease spread and so forth that we have known within statistics for many years, and you can call it AI now, but you can also just call it general statistics. So what is it actually in AI that would denote us for saying that AI would be used? I think that the examples for face recognition and so forth is a really good example. That is definitely an AI system. I think the examples on voice and audio is another really good example. So we are a company that for one is working with audio first and foremost, where we are searching for patterns, and I can. And there are many innovations suddenly with the Corona crisis where we can see that companies are sort of getting the gist of turning into that idea. And one of the problems that we see is that a lot of the ideas are unsolidified when it comes to research, and then they're quickly probed on everything from cough detections to semantics detections and so on and so on. And it quickly becomes a red ocean without any scientific evidence. So one thing that there is a sign of is a few AI examples in industry that are actually working in monitoring disease spread, or assessing whether the public should wear PPE in certain areas, or whether the medical first responders should wear PPE. But I don't see that many AI innovations, and our customers don't either.
And let's have a talk about the business perspective of this for a moment. So you were already a young company, but very successful selling your AI solutions. And then suddenly the pandemic comes in. How did the hospitals mainly react to this? Do they say, we don't have time to play around with AI, we have now to focus on our core processes? Or do they welcome you and say, okay, now is the time to get this innovation started?
I think that they have been extremely mature in the way that they didn't just hope that AI could come in and solve things, but they reached out and asked whether we actually had some solutions that could actually solve something, and whether we could prove it. And I like that approach because proving is key. So a lot of our collaborators they reached out to us, and we already have we are running machine learning on all of their audio data. So that is everything from 911 services to 112 services to hospital acute lines and so forth. So our core machine learning system is out there in production and working on all of these phone calls. So it's quite easy for them to reach out and say, hey, Cordy, can you do something to help us here? And we quite quickly got a hold of the audio data and trained a machine learning system in order to find out whether we could in fact discriminate between a true positive COVID-19 call when calling into, for instance, a 911 service or 112 service, and a non-COVID-19 call. We still have some difficulties with the false negatives. That's a really difficult one to break, because we are listening into the conversation of human beings, and that can be extremely biased. And for our machine learning to catch up on that bias is really difficult. But we from this outreach we computed a quick scientific report on the based on the hospital labels from each individual hospitals in the US especially, and in Denmark. We're also doing the same thing for Sweden now, and then we could rather quickly give them the confusion matrix that they so desperately need in order to see what the sensitivity and specificity is of this system and how well that computes.
So we were already talking about speed, that's something that is at the moment, time is missing at the moment. So I was wondering, and you said, but at the other hand, people are very, very keen on having evidence. Obviously, if you are implementing any AI solutions, you need to have the confidence this is working. We're talking about lives of persons. So can you share with us how fast can you prove something new? I know it's very generic, but can you give us an advice or a hint on how much does it take to convince the customer, yes, this is a good solution?
Yeah, so I can give you the first example. We are covering Seattle, and as many know, the Seattle was the first city in the U.S. to really have the outbreak of the COVID-19 virus, and I think it was back in the end of February where they reached out to us and asked, like, can you start looking at our data? And we quite quickly chose a relation of data points. Said, okay, there cannot be any COVID-19 calls before the 1st of December 2019. So we took all of the data from 1st of December 2019 until the end of February, and then we started testing on the system. But we didn't have enough true positive cases there. So we started out with 15 true positive cases and found out whether we could find a pattern. As soon as we found that pattern, we had the first report on the detection of the system compiled after 3 days, sent that over to the medical director. The medical director reviewed it. We had a big limitation saying we don't have enough data to really conclude something, but maybe this can give you some indications. The indications that gave it, because the AI models that we use in that scenario, a lot of them are explainable, such that we could say, look at these patterns in these calls that that correlate strongly with COVID-19 calls. So they changed their protocols in how they asked for people that called in, whether they were suffering from COVID-19, and then we recorded the data from there on. And from that point, we started onboarding more and more data and got better and better results from the models. So I think that one thing that we need to bear in mind is machine learning is not a binary that it's on off. You can actually get some feedback from a statistical system that learns on the data from day one, or at least day 3, and thereby starting to onboard learning. Then the big problem here is a bias, that you emphasize a bias into that system, because you revert back to the medical director and say internally that it seems like there is a pattern here, and then you need to be very, very aware that you need a control group. So we of course also had a different site in the US where we used that as our control group in order to ensure that our AI system did not emphasize bias in the Seattle protocol.
So looking forward, what would you say, what are for you and your company, or maybe in general for the AI community, the next big chance?
Yeah, I think that from our company's perspective, the COVID-19 crisis has opened up a door for more people to see how important it can be to have an AI system that listen into dialogue. Still, a lot of the diagnostics in the medical healthcare sector is through dialogue. So having a statistical engine that can actually assess all of these dialogues is important. And from our systems perspective, we can see that it's opening up a door for patient monitoring. For instance, if we had our system that is at its current state deployed in Seattle way before the COVID-19 crisis, then they would have been able to detect an outbreak such as this much faster, because it's basically discriminating whether something is out of the ordinary. And then I also see that a big opportunity for us as a company in relation to a new product that we are slowly getting ready to release, and that is basically we are providing a triage protocol for medical professionals that are receiving the phone call and getting feedback from the AI. But we are basically flipping that product around also to the public very soon, such that each individual citizen in the country can also get the feedback from our AI system that has been trained across towards the medical professional. And basically this AI system is an automated AI system in order to make the first part of the triaging when there's no medical professional there in order to help, because we only have a limited amount of medical professionals, and we need to make sure that the right people are attended to first, right? And that AI system towards the public is continuously learning from the medical professional conversations, such that it is actually trying to copy some of the conversation from them.
All right. It seems like you are maybe one of the few companies that could benefit from all this. Thank you very much, Lars, for that. So let's move on from Europe to the other side of the ocean. Let's go to Brazil. Let me introduce to you Dr. Jefferson Fernandez. Hello, Jefferson. Oh, I think you're muted. Can you unmute you, please?
Can you hear me now?
I can hear you very loud and clearly.
Good.
Great. Welcome to our little session here. So you're the CEO of this health consulting firm Specchis and Vice President of the Brazilian Association of Telemedicine and Telehealth. You are a neurologist and you hold a PhD in clinical medicine. So obviously we will have to talk about telemedicine with this background you have there. Can you share with us what are the current developments do you see at the moment? I understood, for example, that Brazil just a couple of weeks ago allowed the usage of telemedicine, or it was not understood.
Yes, that's true. Until February this year, teleconsultation, which is the direct physician to the patient consultation, was not allowed in Brazil by the Federal Council of Medicine. And despite this, some institutions and doctors have been practicing telemedicine or teleconsultation model for some time, based on the legal argument that a regulation by a professional council cannot be superior than the country's constitution. And when the pandemic started in Brazil, in March, the Ministry of Health published an ordinance allowing the teleconsultation. And shortly afterwards, a law was passed by the Brazilian Congress reinforcing this permission during the pandemic. This brought a quick and huge growth in the use of telemedicine in Brazil. And in my opinion, there will be no way back. Even the Brazilian Congress is already working in this direction to complement that law and allow the use of telemedicine in all its modalities after this pandemic. And we should remember that we don't know how long will be this pandemic. I mean, there are researchers saying that we might have 3 different scenarios. One, it is, other waves not as high as this one. Second scenario will be this was a low peak and the huge peak is coming next in few months. The third one, that is, we're going to have waves similar to this one. So this is not something, this isn't something just for the moment. I think this is something that will last for, we don't know how long, but it's not going to be for a short period.
All right, yeah, I guess so as well. We will have to do this for a long time for sure, and telemedicine is here to stay. But let me get back to the situation in Brazil a couple of weeks ago. I didn't understand it. Why was it forbidden to do telemedicine?
Well, I think that the problem was the fear that the Federal Medical Council have that doctors wouldn't use it properly. And also was, I mean, it's an unjustifiable perception. And also that, doctors would lose their jobs because they would lose the patients because doctors from other cities would take care of the patients. So there are many variables regarding to that. And it's for some time now, several years, that we're trying to fight against this position of the Federal Medical Council. And as I mentioned previously, we have this experience that doctors started to use WhatsApp to see the patients. See, because you have this little boy we got some skin problem, and here his worried mother just asked for the pediatrician, for dermatologist that take care of other relatives. What is this? And the doctor, just trying to help, would say, oh, this is something, this is that, and then you should use this type of medication or cream or anything else. So in real life, we're already doing telemedicine. So actually, it's not very easy to understand why there is this resistance of the Federal Medical Council. But now it's too late. Now the Congress took into its hands the legislation, and now there is no way back, in my opinion. I was participating in public audience in the Congress in Brasilia a few months ago, and they are really understanding, the deputies, federal deputies and senators, the needs that we have on telemedicine previously to this pandemic, but now it's very clear. So I think the moment is now that we are going to go forward, and as I said, the path is there, and there's no way back.
Okay, so you have now the regulations set in place. What about the doctors themselves? Are they ready to start with telemedicine?
Yes, this is very important. I mean, some doctors are, as I said, some doctors were already practicing teleconsultation, but this is a process. You have to change behavior, and to change behavior, you have to understand what is telemedicine, telehealth, what are the benefits, what are the limitations, and by knowing how to use it, and use it in a responsible way. And what I mean by that, use it ethically, in a safe and private way, and with quality. Doctors will realize that it's something that came for good. It's not going to replace face-to-face consultation. It's a kind of complement to that. There are situations that you can use as the first consultation. And what is happening now in Brazil? Patients are not going to doctor's office because they're afraid to get the new coronavirus. So they're trying to follow the regulations, and doctors are desperate for patients. So now they are running into telemedicine in not the best way, because now you see some platforms coming up. They're not with so good quality, and doctors are not trained to that. So this is one of my activities. As I came from an academic field, I have built up a short course, e-learning course for physicians for the Medical Association of São Paulo, which is the largest one in Brazil. We have more than 32,000 doctors. And we started a couple of weeks ago with this basic training course for telemedicine. And it's been a huge success. In 2 weeks, we have now about 300 doctors doing this certification, doing this course. As a basic start for that, it's a 10-hour learning course with experts in that, and I'm the coordinator of it. So now doctors are running towards, and this is going to be good because, once experiencing the use of telemedicine, they will see the benefits, and of course they have to learn the limits of that, and they're going to see, well, why haven't I used that before? And so I think this is something that will push forward the use of telemedicine, not only in Brazil, but in other countries as well.
In Switzerland, there was the most strong argument for the usage of telemedicine is, do we get the same amount of money that we have a face-to-face talk? So it's always an issue, I guess, with you as well, right?
Yeah, it happens also. I mean, it's starting to happen here also in Brazil. And I think that this is, we have to, when we see the use of telemedicine, we have to take into account three main players: the physicians, and this question of reimbursement, as you said, it's very important. Second, patients, but patients, once they experience that, they like it because, they can have access to their doctors or to any doctor anytime, whenever they want. This is very good. So they come closer to their doctors, and vice versa. Doctors can come closer to the patients. And the third player are the health insurance companies. They already know that telemedicine is of benefit because it can not only provide increase the access for the health services, but it can bring better resolution to the health problems. It can help the organization of health systems and services, and they can reduce costs. but still they have to learn more on how to use and manage these telemedicine services to disseminate its use. Just calling attention to the fact that I told that we should do a responsible telemedicine. So it's something that it's a construction, and education is very important for that.
Yeah, I guess so. There is a lot of debate here as well if telemedicine is really going to reduce cost. But let's not focus on that. Let's focus for one moment on the patients themselves. So we had a survey in Switzerland in November, so before the pandemic, and there only half of the people could imagine, so that's very low, imagine having simple conversations, simple consultations with the doctor. So that was before the pandemic. Do you have similar numbers in Brazil? Do you think they were also already more open before the pandemic to telemedicine?
Yes, they were. They are very, keen to talk to the doctor in any way. We did a survey, and there was a Deloitte survey also in Brazil regarding the use of digital solutions to talk with doctors, to talk with physicians. One was published in 2016, the other 2 years later on. And Brazil is, compared to other countries, we have high communications of doctors with patients, and either way, with these digital solutions, WhatsApp, Skype, and so on. 7% of patients said that they used to talk with a doctor using these technologies. So, and you can see with this with these institutions that I told you, and doctors that are already using telemedicine, doing teleconsultation, despite of not having a regulation for that, the satisfaction of the patients is high. One of these institutions, one hospital here in São Paulo, now have already a kind of a base of 2 million patients using their teleconsultation system. And the satisfaction is very high, over 90%, 90%. So I don't think patients have the problems. I think the main question is the physicians, and also now in Brazil, we have to discuss how physicians are going to be paid for that. So this is something that is starting. But in other countries, such as the USA, this is still an issue, because even there, where teleconsultation is being done more than 20 or 30 years, they still have not been disseminated enough. The experience in this with this new coronavirus pandemic is being very interesting, because all telemedicine services are being overloaded. In Brazil, one company here had to hire almost 200 doctors for their telemedicine service direct to COVID. So this is something that I think will change with time. And as I said, as this pandemic or the epidemic will still go on, I think people will realize the benefits of not having to go to places where they can get the COVID-19, or they can disseminate COVID-19, and also to protect doctors and physicians. You see, it was mentioned before in Israel, the use of TytoCare, for taking care of COVID patients at their house. This is something very, very important.
For sure. Let's focus as the last question a little bit on the potential of telemedicine. And I was reading a paper by a company offering telemedicine services, so they are biased, I guess, a little bit, but they claim that the typical patient-family doctor interaction that you could make around 90%, you could replace face-to-face meeting with telemedicine. Where would you say, where's the limit? What would you still do in a personal way, and where would you say, yes, you can for sure use telemedicine for that?
Yes, I think you can use telemedicine in several situations, for promotion, for prevention, diagnosis, treatment. You just have to know the limit. The doctor just have to know the limit where to use it. When you need really to examine patient with your hands and with your eyes, you should recommend face-to-face consultation. We know that we have the telepropedeutics. Using these devices, you can examine a patient in distance, but there are several situations that you need to see the patient in person. not to say urgent situations, telemedicine just for the few recommendations, few guidance, then the patient should run to a hospital, to emergency department. So there are several situations where telemedicine is not the best way to do diagnosis or treatment. But in many times, in situations such as the primary care attention, primary care physicians can use it, you know. And I think that with time, people will get more confidence in using telemedicine. And I believe that the use of telemedicine will progressively increase in all countries, especially after the experience of its use in this pandemic. And it's important that we have to consider the aspects that relate to the availability of technology that is getting cheaper and cheaper, and also the aspects that once you have, because I think there are two issues that I would like to say here. First is the one that relates to continuity of care. You know, in our health systems, we work in kind of silos, and digital health solutions can bring this continuity of care from health promotion, health prevention, treatment, diagnosis, and taking care of patients at their home. And what is the place that people are more likely to need that, or more likely to have these solutions, the care being provided? It's in their home. So I think that an integrate digital solutions that helps in the continuity of care and brings to patients' home most of its needs. Now that is not only appointments, payments, but also all the aspects of clinical care. I think this is the aim. You know, patients should go to clinics or hospital only when really needed, only when the doctor needs to see a patient face to face, and the rest should be done at the comfort of their homes.
All right, I see a bright future for telemedicine. Thank you very much, Jefferson.
You're welcome.
Ralph, in between, I would like to ask you the question, is there anything our viewers would like to know here from our experts so far?
Yes, we indeed got a couple of questions. Have already narrowed them down a bit. There were a couple for Eyal, Lars, Jefferson. Maybe pick up the one for Jefferson's. It was a generic one. How is Brazil coping as a country right now and overall? I think that wasn't asked, so someone asked it.
With COVID, well, Brazil, it's huge. It's a continent by itself. So we have different situations in different regions, or even in different states and cities. The cities that started early to do digital socially, distant socializing, and are the best ones now with lower number of cases of death. Those who were resistant, though, as expected, they are having larger number of cases and of deaths as well. And we have some regions such as the Amazon region, where they have a very low health structure. So they are now collapsing in terms of health care, in terms of ICU beds, in terms of hospital beds. So this is a real problem, and all efforts are going there to Amazon region and Northeast region.
All right, thank you, Ralph. Thank you, Jefferson, for the answer. I would like now to come back to our country, to our continent here, and welcome with me here, please, Professor Dr. Jing Wang from the ETH in Zurich. Hello, Yang.
Hello. Nice
to have you here. You were born in China, but are working now here in Zurich at the ETH at the university. You're their professor for industrial ecology and environmental engineering. You have a PhD in aerospace engineering, and you are heavily focusing your research on detecting the virus. Is that correct?
Yes, that's right.
So now the big challenge will be to explain everyone without a technological background your research. So how do you, or what are you exactly doing to be able to detect this virus from the air, as I understood?
the detection of virus, so that plays a significant role in this combat against COVID-19. So everyone knows very well. So for diagnosis, you need to go and the standard, the reference method is the PCR method. So that's a method to measure the RNA. So this is the genetic material from this virus. And if you have this virus in your body, and you can get the biological samples from your body, and with this PCR, so this is basically a amplification method, so that from a couple of RNA copies in 1 hour, let's say, some of the instruments have longer, some of the instruments have shorter time, then you can multiply this number to millions, and then you can get a signal, and then by this signal you can say, okay, you have this virus. So this is diagnostic method used for the basically a confirmation of someone has this virus or not. So for my research is mainly in the field for the environmental, especially air quality. So in the air, we know that this virus is a respiratory infectious disease. So basically, for the infected people, when they speak, when they sneeze, coughing, so of these would coming out from the respiratory droplets, and some of these would be floating in the air for a certain period of time. So detection of these in the environment, that also plays a certain role in the early warning systems. And if you know that in this area or in this part there are a lot of viruses floating in the air, then you will certainly be very careful. And in the hospitals, you would like to know whether this part of the hospital or that part of the hospital is safe, under what conditions you have to wear a face mask. You have to wear at least a N95 face mask instead of a surgical face mask and things like that. So for those purposes, I think it's highly valuable to have a sensor which can detect the virus in the air. So as I am working in the field of air quality, so this is has already been for a while that we try to detect the airborne viruses and the bacteria. So we already before the outbreak of the COVID-19, so we have already been working in this detection of the bioaerosols, including viruses and the bacteria. So therefore, once we are focusing on this virus, we improve our system. So we are basically using a plasmonic-based system. So this system is optical. It's an optical instrument. So we have so basically the RNA, this genetic material, the genetic material can go through a hybridization process. You know, the DNA. So basically have a double chain DNA. So they can hybridize. So once this, we can manufacture the complementary DNA sections. So this complementary DNA is placed on our sensor. So once the virus, the corresponding RNA sections, and then it's transcribed to the cDNA, and once this can be captured by the complementary DNA sequence. So once this occurs, then it induces a local change of refractive index, which could be detected by the optical signal. So then with this, then compared to our previous one, we also have temperature, basically plasmonic photothermal effects, which can improve the selectivity, so that will help us to identify and accurately detect the SARS-CoV-2. And then even we also tried to make sure that the selectivity is very good. So we tried even the previous SARS virus. So we are able to differentiate the previous SARS virus with the COVID-19 virus.
So how did you already have a sensor that were able to measure other viruses? So that's not something you are doing for the very first time, right? So you were already able to detect virus in airborne virus beforehand.
Yes, so basically this is what is your target. So you have to functionalize your sensing element with respect to your target. So for example, this DNA-based capturing, so we have to put the complementary DNA section that is specific to the target RNA or target DNA you are detecting. So, or for the bacteria, for the virus, you could have one antibody which is specific to that bacteria or virus. So with this kind of specific method, you can tune your sensor so that you can make the sensor very specific to the specific target.
All right. How do I have to imagine the sensor? How big is the sensor?
Well, right now, this is still a research instrument. So right now, the instrument is probably 30 centimeter, and also we have an optical system. So the light, so we have the light generator. So we have different lenses, and then the spectrometer to receive the signal. On the top, we have another piece of laser. This laser will induce the plasmonic photothermal effects. So right now it's still a research grade instrument. It's not ready to be deployed in the field yet, especially this part. So a lot of time we say, okay, where is your sample from? This plays a essential role whether you can detect this or not. And then in the diagnosis, we know, and one of the previous speakers also mentioned the detection is sometimes it's only the 50% correct. You have false positive, false negative. So a lot of this is dependent on where's your sample from. If you are not sampling the patient at the correct time, you are not going to get this. So the sample preparation, this still will take significant work. So in our case, well, this is a detector. You can use this detector for the patient, the samples from the patient. You can do a swab on the door knobs. You can do a swab on the sensitive surfaces, and you can also get this from the air. So you can have a pump and then draw the air and then collect a lot of the airborne particles floating in the air and then transfer this to the sensor. So a lot of these still need significant work so that we can get to the necessary, the sensitivity that is needed to give you the concentration of the virus in the air.
And I guess you always get, when you research, you always get the same question, like, when can I buy it? When is it going to be ready for the market? And how expensive is it going to be? And they have to understand that you're maybe weeks, months, years, decades away from the product. Can you share with us how long until we can really have a market implementation of that?
Well, you can imagine that I got this question a lot in the last couple of weeks. So as I mentioned, right now it's still a research grade instrument. We use this in the lab, and so we are, right now we continue to do the development. There's still a lot of work, and if we are researchers, we are not a big company, pharmaceutical company, diagnostic company. So for the large companies, they put a lot of resources in this. They can develop this very, very fast. And this also depends on what is the strategy of our technical transfer department. If we get to the involvement for the large company, this could be quite fast. And so basically these are engineering problems we need to resolve, and the engineering problems for the large companies with enough resources, it probably can be achieved in months. And if we are going to do it ourselves, maybe we'll need 1 year to get it done. And right now it's difficult to talk about the cost. It depends on how many pieces you will produce, and if you will produce a very large amount, it probably can be relatively cheap, but still it's an optical instrument. You still need certain parts of that. And then I know that right now this very hot topic is point of care, right? So the patients, if patients can get something like you can do a pregnancy test. It's just one piece of strip, and then you can do this test. And this is also a lot of this is also the target a lot of companies which develop the point of care, very easy to operate disposable sensors like that. So there are different directions, and many different groups are working for the detection of the virus.
You know, me myself, also in a university, I know how hard it is sometimes to get the funding, the money for your research. But I guess there are 100 people trying to invest in you in the moment, right?
Right. So of course we have a lot of inquiries about the direction, and I still need to talk to our technical transfer department and figure out what is the best strategy. And you know, we are not just thinking about which company will offer more money. It's also the capability. Some of these companies, they already have a lot of the relevant products in this direction. So that would make the development much easier and faster. So we are still looking at the possible partners in this.
Maybe one last question. Looking forward to the future, do you think in 10 years from now, every hospital will, in every room, you will have a sensor measuring a lot of different bacteria and viruses? Is this the future you see in 10 years?
Yes. So as everyone knows very well, so this Internet of Things, driving force of this is basically the sensors. So the development of sensors, then right now you can pretty much get a huge amount of data. If you are going away from your home, you want to know what's the temperature, what's the relative humidity, if your cats or dogs need the food or not, and all the things like that. And so I think especially now and then after, so this is already one of the, you know, after SARS, the swine flu, bird flu, and then this big one. And I think people will be very aware of the sensors which are needed to do monitoring and early warning of the spread of the infectious diseases.
All right, Ying. Thank you very much for sharing with us your research. Now, let me change for a last time to Andrew Kingham. Andrew, can you listen to us?
I think I'm on.
You are on. Excellent. Andrew, you're the CTO of the Dutch company Iristras. Iristras is a company creating software, e.g. for administration processes in hospitals. You have a marketing and electrical engineering. Welcome to our session here.
Thank you.
So we heard now a lot of innovation, a lot of solutions, many of them regarding the medical aspects, like we were hearing about the virus itself. But I think the digitalization of the business processes is as important as all the medical core practices. Would you agree on that?
Well, hard to disagree with that. In fact, I think if I come back to what Dr. Berge said is, I mean, we're talking a lot about resilience, right? So the adaptation to an adverse event and the speed at which you get out of it again makes me think a lot about the need for agility and flexibility. I mean, obviously the systems have been, let's say, put to their limits in terms of that, and facing the unknown, you have to think on your feet and you have to be fast at implementing what you discover. And I think that is one of the learnings coming also out of the projects with the hospitals we got through, where in fact, for about 4 weeks solid, every day you would get an additional requirement that come in because we learned something, or because there are new machines available with different metrics that need to be kind of consolidated and that need to be put into use. And a lot of it is about sharing of information, lowering the administrative effort, because the less you spend time on that, the more you should have for your patients, for the care, because that's the key part of the business that we're talking about, right? So, and that's, I think, what's been driving us a lot is how can we actually help with appropriate digital strategies to get the business as lean as possible, and and to minimize the time impact on people who should be spending the time on patients.
Yeah, that's so true. We know from our own research that our doctors in Switzerland and hospitals spend maybe 20% of their time directly patient contact, the same for nurses. so in their most highly paid professions. And yes, from a business perspective, this is obviously a catastrophe, and we should aim for putting them in their task they learned all their life. But now you were mentioning strategy. And we know from our own survey that only around 1/4 of Swiss hospitals have a digital strategy. And you have been working in Germany, now in the Netherlands. Is it different with your countries? I hope so.
I do think that digital could be, let's say, even more part of business strategy. And I always worry about when somebody has a separate business and a separate digital strategy, because that is probably the best way of isolating innovation and putting it into a lab and testing it and basically, you know, having it as a proof of concept, but never really making a real difference on a daily basis. And I think what I'd like to see a little bit more of is to saying, okay, well, we should probably have a different way of measuring the success of innovation projects, specifically in the IT area, which would probably look into the time that it takes to actually deliver value, rather than just let's say the overall economic value that will come one day when everything is implemented. And I think, you know, coming as a small company out of the startup world, you go for a lean approach, which is incremental value and iterate fast, and also based on what I would say a people-centric strategy, because at the end of the day, it should help everybody, and there should be something in it for them, for everybody using that. And I think that is also what social media, etc., has given us is a certain expectation in terms of ease of use and speed of use and intuitive, let's say, use, where there's an immediate value. But I think in the context of the enterprise, there's obviously more in it for everybody, because everybody benefits of the kind of knowledge that's being created and shared. But it has to come with more ease, I think, and also without necessarily deep IT expertise to replicate knowledge. If you have a good protocol, that should be, let's say, rolled out. It shouldn't take forever, and you need like a whole raft of let's say, IT experts in order to get that implemented and rolled out. And that should be a matter of days or maximum weeks, but not of months or longer.
All right, so you were speaking about having integrated strategy with your digital strategy and the strategy. I fully agree on that. And now let's imagine that in a patient-centric way, as you mentioned, you decided for being able to be patient-centric, I need all these digital technologies I have been hearing all evening along, and we need to roll out that, we need to make a transformation. And I know that you have been helping companies to transform for the last decades. Now, what is the secret? Can you share with us what did you see as key success factors to have a real good digital transformation in your, let's say, hospital?
I mean, look, I think there are a lot of people who have a lot of expertise in this area. My own take is that, again, there is a need for people to understand why you're going where you want to go as an organization or as an industry. And I think this why is obviously more clearer in the face of the COVID crisis we're facing. But the why is important. Also the way you get there, you have to bring people along, and people will need to want to have it done. You heard earlier the case in Brazil where people said, well, I already do kind of teleconsultation because I'm using social media for it. In a way that is also what helps you make a digital project more successful is there is a clear understanding of a commonly shared goal that will actually make an impact from a business perspective and make your life easier or more safe in that sense. And there, I think that is clear that this should be at the center of your reflection. But surely after that, it's also about your ability to manage an agile delivery framework. And so it can be, a mixture of in-house and external solutions. And but what's important is that you have a pretty good idea about your data governance strategy, and making sure that you've thought about that, and then you can hopefully move and also consume cloud-based SaaS services, integrating it within your overall, let's say, direction. And but the idea is that you can actually roll out solutions, deploying, let's say, solutions to infrastructure as a code, so you don't spend a lot of time babysitting machines and managing network policies in detail and worrying about disks that fail, but where things are, let's say, deployable as a code based on templates within minutes, and that allows you to be truly agile in bringing components in and testing them out in real life with real, let's say, business practitioners, and scaling them when they're successful, or not continuing if you think that, well, it was interesting, we learned something, but we don't want to continue that way. And I think that is certainly something you can do. But then there's also obviously a mapping exercise to understand where you create the largest impact, less business value, and also try and then therefore do the research about solutions that can address those. But also find people who are willing to give you on a smaller budget, like focus projects so that you can implement, go live, and accelerate the experience cycle. As a learning organization, you will then soon find out what really works well and scale that. And then obviously it's of help when you find an ecosystem of solutions that work together well, because after all, some vendors put a lot of effort into integration capabilities. So from the get-go, you're kind of sure that things play along nicely. And I mean, for us, for instance, that meant it's very clearly we support integration with market solutions, market-leading solutions like SAP and Microsoft, for instance, so that the benefit is there and the risk is low. So I think those are some components of the recipes. I'm sure there are others, but I'm not sure how far we can go into that level of detail on this call.
Let's focus maybe on one of the problems I hear very often from managers of hospitals and other providers I talk to here is about this like fragmented situation at the moment. Like they talk to 20 people and they will say 10 different things they should focus on about technology. Here in this round, you will hear someone say telemedicine, so AI, you should focus Internet of Things. So what can you do as a manager to get an overview to know what is really the way to go regarding digital health technology?
Well, again, I mean, it depends a little bit where on your phase and your level of maturity of your IT organization and what you want to solve right now. I mean, right now I've been pretty much challenged on a daily basis about like how do we help people get better in the face of Corona, right? So in working directly with the doctors of intensive care unit in some hospitals, we were looking into, well, what would actually make a difference to the patient care, and that was the leading, let's say, indicator and goal to achieve within a certain time frame. And I think it's not a journey where you do everything at the same time. So you will have to pick your battles and start with the lowest, most pressing needs, and also where you have the biggest chances of successfully implementing something. And I think that is not one size fits all in that sense. So it's difficult to give advice because it will depend a lot, in my sense, on the individual situation that the healthcare providers are facing in the context of their work. And I mean, we work, for instance, now with people in Latin America, where they said, well, in fact, the mobility aspects and the outside of the hospital aspects are equally important now. We face issues on, networking capabilities into the VPN of the hospital. What can we do to lift this? Can we use a different type of infrastructure? So that could be, a key to unlocking a lot more value. But that's, again, very dependent on the environment. I hope that helps a bit, though.
I hope so as well. Let's make it very concrete. You said in the transformation phase to have a why, to answer the why, to have a common purpose is so important. I was just listening to chief medical officer from a hospital here in Switzerland, and he was saying we were not prepared for this pandemic because we were spending so much time with our IT. So instead of thinking about technology, we should have prepared for that situation. So just the opposite what we have here up to now, like with the pandemic, it's so clear that we have to digitalize. He was arguing the other way around. So my question to you is, if you want to create in such an environment a common why, how would you approach that?
Well, I think in such an environment, the common why is clear. I would have thought it's probably the way how you get there that might be a little bit more controversial, and I'm sure that is part of the discussions that are going on. But in my sense, it is if you get IT to lead the people that are leading the actual charge in providing care and new, let's say, protocols to better take care of the situation at hand. That's where you need to have very supportive IT, and it's not IT for IT's sake. In that sense, it's really about making it happen together with them, and to bring that part of the puzzle that will make the teams of healthcare workers more effective. in particular, we have a number of people working together hand in hand, and of course the ways that people have been working, to feed a computer, just having to take off protective equipment, go to the disinfection procedures to get out there, etc. I mean, that's not an efficient process, right? So it's much easier than to be sure that you have the terminals and the mobile devices at hand without having to go through these procedures. And so I'd say there the IT is a supportive role rather than a leading role, of course. And it should be like that in order to get the business strategy implemented.
All right. Thank you very much, Andre. And with this, I would like to pass again to Ralph Haller, because we're nearing the last part of our session. And I would like to see if there's a question from our public.
Yes, Alfred, we had a bunch of questions. The most got EAL, so maybe I picked in one there to be fair, right? One was related to how important was in Israel the use of the mobile tracking, and to use it or deploy it rather quickly, even against strong critique from some in the public, and how important was it to overall that Israel has obviously performed quite well during this crisis, being so fast with this, despite privacy critique, I think. Yeah.
Yes, it's a good question, which unfortunately I don't have a good answer to, because we don't exactly know what were the outcomes of specifically this intervention. As you were mentioning, there was a lot of critique. There is still critique, and I think, as far as I know, we're not using it anymore in the past few days. Since the situation here is much better now, the government has stopped using that tracking system. There was a lot of obviously discussions here in Israel, and it went to the Supreme Court, which allowed it during the high times of the outbreak a few weeks ago, maybe 6 weeks ago. And again, we don't know exactly what the effect was. It was never published. If you ask me specifically, I think it does help with the initial steps or the initial phases of the outbreak. But at some point, when you have hundreds of new cases every day, it's almost impossible to try and track everybody. And so the idea is obviously to try and get people into social isolation and isolated at home with the lockdowns and everything. And I think at that point, the tracking app, doesn't provide as much value as in the initial phases.
Another question, right, from our viewers?
Yeah, there was one for Professor Jing Wang, but I think he answered it himself then. Came earlier about the commercialization of his sensor. I think we probably addressed that. So with that, other questions we will put in the community, and then panelists can answer it there, or other people. Yeah.
All right, thank you, Ralph, for that. Now I would like to share with you the results of our survey. Is that possible, Ralph? We asked people about, is this going to be a lasting effect, the pandemic, on digital health? Are we going to really see a widespread use of technology now that we saw how important it is, digitalization of our healthcare system?
It should be actually published. If not so, Dominic is going to do it. So the results should be available online. They should see it. I don't see it myself, but I don't have the view from the audience.
Let's assume, as always with technology, that it works perfectly and that our viewers are viewing it at the moment. So to finish this up, I would like to go now backwards. I would like now to start with Andre, and one last question to you guys. I would have one last question. Can you give me one, most 2 sentences, your takeaway on our session here? So any insight, any forward-looking aspect you would like to share with us? Andre, can you start, please?
Well, I mean, I think we did talk a little bit about this resilience aspect, and the fact that you can have to help, in this case, the the first line responding to the crisis, right? But if you help them well and you get the best from that, it's actually useful also for the management level and also for the outbreak management team level that will actually harvest the data and the statistics. So I think bringing together all these different disciplines and aspects to a comprehensive set of solutions is super useful. And so I want to say big thanks to you guys for organizing this.
Thank you very much, Andre. I would like to pass the word to Ying. Some last words from you, Ying, please.
Right. So for me in the field of technology, I think in the medical field, the technology has been in the recent years really in the forefront development. The most the newest technologies and the fast development have been quite frequently in the medical field. So I think there's a very strong motivation to have even more technology in this field, and I'm quite sure that with this crisis and the technology, the people who are developing the technology going to respond, and we will eventually have the necessary technologies to fight the pandemic.
All right, thank you very much. Let's go to Brazil. Jefferson, any last words from your side, please?
Yes, can you hear me? Yeah, okay. Well, I think that all digital health solutions that have a clear purpose and are evidence-based will grow for the next years. I mean, it's a growth that we have been seeing for some time now, but I think they have to achieve the needs to identify and achieve the solutions that achieve the needs that were well needs. And I think we should be more prepared for that, because overall we are not being very quick in deploying solutions for this pandemic, digital solutions, I mean. Perhaps as in clinical research, that people who are just starting to do something and they are not also prepared for solutions that would help in these difficult times. I think digital health will also need to be more agile and find the proper solutions for this, the needs that come out as such this pandemic.
Thank you, Jefferson. Let's go to Denmark. Lars, any last comments from you, please?
The last comments from the other panelists were really good, but just to add to some of the comments is that I think that the one thing that we have in mind all the time is that one thing is to make a COVID-19 detection as a product, but we also need to look ahead and see towards the next pandemic and the next disease and so forth, in order to ensure that we are not so unprepared for the future. So that is at least one thing that we as a company prepare ourselves for. And I think that also the healthcare industry, in terms of purchasing generic solutions that can actually help monitoring society and so forth, despite surveillance fear, I think that is one thing that I also take away from this conversation. That would be really good, that we stay on the forefront and we keep on having these innovative health technologies amongst the first priorities when investing for the healthcare sectors.
All right, thanks, Lars. Now let's go to Israel. Eyal, please.
Sure. So, I think it's evident, and also from this panel and with the previous speakers as well, that, this is a high time for digital health, and maybe specifically for telemedicine. And we have a saying that you need to hit the iron while it's hot. And it's certainly hot right now. And that this is the time. We all, most of us here are working in the digital health space for a while. We're trying to promote and push this well before COVID-19, but there's a clear opportunity right now to make a huge improvement and huge leap forward. And I think we will remember back to these days and these months, many years to come, and look at the opportunity we had here, and we need to take a good use of that. So we need to keep ourselves busy in the next few months.
All right, thank you very much. Ran, your last words for our community, please.
First of all, thanks a lot for the invitation to present my views. I understand that we are all enthusiastic about digital health. I totally understand that. But I mean, I still believe that digital health is a tool and not a magic bullet. And providing healthcare is a very human interaction heavy activity. But the use of digital health, I mean, especially like what Lars mentioned, the CAR-T or other technology in COVID-19 or any other pandemic in general, will allow us to free up time for our doctors. I mean, the tasks which the doctors have to do can be, used more efficiently, and also the use of AI and other technology to look at signal detection in the system to act fast and decisive. I think that is the key application of digital health. It's not a magic bullet. So if someone is looking for that, I think they're looking at the wrong place. So that is my view. It's a little bit different from the rest of the people, but that's the way it is.
That's correct. Thank you very much. And last but not least, Evangelos, your last words for us, please.
I mean, what we heard today is that the number of sensors and the accuracy will increase over time. So this means the number of data will also increase over time, and we should be, the intelligence around the data, machine learning, AI models, whatever, would also increase. So the maturity of how to use data and insights will be part of our future. So when I think about 20 years back, when we asked people, would you buy something using mobile phone? Everybody said, really? Why mobile phone? So why use that? I think in some years from now, we will be in a similar situation where we transfer all these insights on medical kind of application into, this will be part of our daily lives. And I'm looking very forward rather to that. The main thing is that we need also to change parts of the policy making in addition. And I think this is the hardest part. It's not only about technologies and enablement of technology, but changing policy system and also all the reimbursement, everything we just touched upon right now are things that just might take some longer.
Perfect. Thank you very much. So I don't want to spoil or ruin these last words by having my own ones. The last thing I want to say is thank you to everyone. You were a beautiful panel. I had a great discussion. I hope that our viewers also had a great time. And also to say thank you to Ralf Haller and his team from HITECH Connect, making this possible. He was agile as well. It was supposed to be a real life event. Now we are here sharing with each other over the internet our insights, but I think this is as important as it was in personal. So, and my last for you, my last comment would be also to be active in our community. Ralf has put a lot of effort to have there a community, so everyone is invited there who is participant there. This video will be up there. There will be other beautiful videos as well with our participants going more into deep about the topics we talked today. So thank you everyone and see you next time somewhere. Bye-bye.